All in. My name is Colin McWhirter. I'm the Chief Program Officer at Community Human Services. I'm joined by Alicia Romano, CEO at Community Human Services. And Brandon Sink is our executive assistant who's running our presentation today. We have a short presentation about some potential funding that we are applying to through the state of Pennsylvania for the home ARP program through the American Rescue Plan. Part of the funding asks for community feedback. So this meeting is to launch that process. And explain the funding that we're going for. We have not submitted the proposal yet. That's not due for another week and a half. And so this meeting will be the starting point where we'll then ask for either live feedback during this meeting after the short presentation, and then through a form we'll send out tomorrow to give feedback through like an internet response form. So,
can everybody see this?
Yes, we can see.
All right. So this proposal is being submitted in partnership with between Community Human Services and with Oakland Planning and Development Corporation and People's Oakland. These three organizations have collaborated over the years on many things, and so it makes sense that collaborating together for this, which would expand some mental health services and therapeutic services at each organization. The main area of this is to enhance CHS's therapeutic programs and that are currently available to individuals experiencing or at risk of homelessness who would like mental health services. Like I mentioned, we'll use these strategic partnerships with our two other community organizations to reach more eligible participants and provide a thorough array of services. So by combining our efforts, we'll be able to have much more broad outreach and connection to the community, and then also more services than just one organization would have been able to provide. There are multiple things at CHS that will be included in this proposal. One will be part of the funding for our Assistant Director of Therapeutic Services. This person provides direct therapy for individuals experiencing homelessness or at risk of homelessness, and ambulance going outside. And they also supervise all of our therapeutic staff, which include our CRNP, which is a nurse practitioner, any other therapists we have or will add in the future, peer support specialists, and any social worker therapy interns that we have here at the CHS. So just kind of explaining some of the other positions that would be expanded under this proposal. So our licensed nurse practitioner, the CRMP, we contract this position for medication prescribing and management. This is a contracted position because we only need so many hours. Right now, we are contracting 8 total hours at CHS, but only 4 of those hours weekly are for this specific at-risk population or homeless population. So we would be able to increase this significantly with this funding. And we would estimate that we could serve up to 50 individuals annually with this as well. And that would be in coordination with therapeutic services that we'd offer through our assistant director, who is, I should mention, a licensed clinical social.
Can I just interrupt you for just 1 second to point out that you're not advancing through your slide deck, if that was your intention? We're just still seeing the front
we
page.
are on our end.
Well, we don't have the slide view up, I think, at the moment. We just have the PowerPoint open. So
You want to try to reload it, Brandon?
Wait, so what are you seeing?
I see the PowerPoint, piece open, so the slides on the side, as if you were editing it.
Oh,
But
I
it's
see.
dancing through because we don't have the slideshow up.
Interesting.
If you were
Um,
only, if you were only sharing your, a specific thing on Zoom as opposed to your whole desktop, then it only chose the PowerPoint and then it didn't, like, opening it, opening the slideshow is a whole different window, so you just have to modify the thing that you're sharing.
Maybe unshare and share again.
Sorry.
No, you're fine. Thanks for telling us.
Still seeing just the PowerPoint open, see your cursor moving.
Okay, right. If it just maybe I said it.
Yeah, we could do that.
Yeah,
But
so
why don't you
instead-
start the show and see if it works, and if not, then we can just click through it and edit. It's
I'm trying to, it's not,
not going.
no.
If you choose view on this thing. Bear with us
Look,
all, technical
Like,
difficulties.
literally nothing's happening.
Yeah. It's not even letting you choose the.
No, this is, I hate Zoom.
I'm so sorry. If you were able to just open up PowerPoint and just so long as you're clicking through the slides,
Yeah.
be able to see large enough to be able to read them.
I'll see if it.
Yeah, I think we'll set it.
There.
Outstanding. Here you go. This looks promising.
All right.
Okay, so now can you see like the full screen?
Now we see the full screen. So sorry. Where were we?
No, no, that's okay.
You were talking about the therapeutic services. There we go.
Alright, so did it switch? Okay, great. Yeah, so after CRP, we also have peer support specialists. This is gonna propose two positions, in addition to what we have, and that support following services for 75 individuals annually. So there's a lot of accessing and accepting CHS services that peer support specialists work on. This would obviously apply to the entire program, so some of the services we mentioned later as well. SOAR is a program to help people increase their benefits, or better benefits. And so we'd be having one of our peer support specialists be trained in SOAR and would work specifically with people to complete the SOAR application and increase their benefits that way, mostly applying for security disability services. And then also recognizing that services need to continue long-term. Peer support specialists help people transition from the services in this program to mainstream services once they are kind of established with mental health care. And then also peer support specialists can stay with people beyond when they maybe exit care of this program for a long-term connection and stabilization as needed. So additionally, we're going to contract with our two other community organizations. One is People's in Oakland. So this will have support through a social worker. We're estimating up to 25 individuals that could be referred annually for this program. And the main service at People's Oakland is social rehabilitation services and support. And this would be able to be a two-way referrals, so not only could CHS refer people, but open planning and development could also refer people directly as part of this group that would be able to receive services and meetings. And then the last piece is, go ahead, outreach and engagement at Oakland Planning and Development Corporation. This will also be a social worker position that would refer low-risk people, I'm sorry, low-income people who are at risk within their community. They're a housing provider in Oakland neighborhood, and so come across a lot of people who need and are looking for services. And then also there are connections to street homeless individuals in the Oakland area that could be referred for services either at CHS or at People's Oakland. So those are the three prongs of the program and the funding that we're going to be requesting. So enhancing all the services in CHS and then also bringing in these two partner organizations to kind of get more outreach and then also have more thorough services. So I'm open to any questions if anybody has it.
Is someone trying to unmute? Not seeing any questions coming in from the attendees. We will be posting the recording of this meeting to our website, and there will be links available from CHS and from People's Oakland. And we will distribute the link broadly across our networks as much as we can. Make sure that people have the opportunity to see this video, see this recording, and send us questions in the event that they weren't able to attend this evening's meeting. I'd just like to say from OPDC's perspective, this is basically making something, this is strengthening services that we already provide in order to be able to really, have a measurable impact outside of the buildings that we manage. So we currently do have, we own and manage 100 units of affordable rental in Oakland. We are looking to provide expanded services as much as possible in Oakland over the next couple of years, but all of which would require additional supportive services. And this is one means by which we're really hoping to kind of leverage all of the wonderful relationships that we've built over the years with CHS and with People's Oakland, as well as other partner entities, to really make it possible for us to connect people to the services that are available to them. Lizetta, did you have anything you wanted to add?
Trying to am I mute? Can you hear me?
We can hear you.
Okay, technology. Just to reiterate what Andrea said, that we would like to continue to reach a broader, have a broader outreach, and all of our services complement each other. People's Oakland offers an array of services aimed at holistic recovery through counseling and therapeutic support, social and recreation services, employment service, nutrition and fitness, and resource coordination. So this will be an opportunity for each agency to continue to provide the great services that we all do, and connect individuals to the resources and services that we don't provide within our own building.
With that, we will place this video on our website at opdc.org, and we will make sure that everyone has a link. People are welcome to send us questions. You can send questions to our attention at questions@opdc.org. We will happily forward them along to the partner organizations as needed, and we will report back all of the feedback that we receive. No one else has anything? Thank you all very much for joining us.
Thank you.
And thanks to
Thank
Sage for this opportunity.
Thank you.
Thank you all.
Oops, we have one more person who's just joined. Sorry, Mr. Stevens. We've just completed the information session and we will keep a recording on our website where you can review it. It'll be available later on this evening. And you can send us questions at opdc.org. Thank you very much.